Would you know what to do if you were having a heart attack, completely alone? You're over 60. You live independently. Maybe your spouse is gone. Maybe your children live far away. Maybe you're just enjoying a quiet evening at home. And then it hits you. A strange pressure in your chest, maybe pain down your arm, shortness of breath, nausea. What happens next could be the difference between life and death. I've seen it happen. I've treated patients who were lucky and others who weren't. Today, I want to give you something that could save your life. Not theory, not scare tactics, but clear, specific steps you can take if you ever find yourself having a heart attack alone. In this video, you'll learn how to recognize subtle symptoms that most seniors ignore, the truth about acting fast and why minutes matter, what to do with your phone, even if you can't speak, how to stay conscious until help arrives, when and how to take aspirin safely, why preparation matters more than strength, and the most powerful thing you can do right now, before anything ever happens. These are 7 life-saving tips every senior must know. Let's start with the most important thing. Know the quiet symptoms. What a heart attack really feels like after 60. A heart attack after 60 doesn't always come with a dramatic collapse. Often, the symptoms are quieter, slower, and easier to ignore. It might feel like mild chest discomfort, or pressure that comes and goes. You may not feel pain, but a strange tightness or heaviness. You might feel unusually tired. You may get winded climbing stairs you usually manage just fine. Maybe you feel a little nauseous or dizzy. You might break into a cold sweat. I had a patient once who felt like she had indigestion. She waited 4 hours before calling anyone. She barely made it. Another patient, an 80-year-old man, just felt weak. No chest pain, just weak. But his arteries were 90% blocked. Your body will try to whisper to you first. Listen to it. Don't explain it away. If you suddenly feel off in a way you can't explain, call for help, especially if you have risk factors like high blood pressure, diabetes, or a history of smoking. Act fast. Why every minute matters. The moment a heart attack begins, your heart muscle starts losing oxygen. Without blood flow, the heart starts dying. It only takes minutes. Every minute you wait to get help is more muscle lost. Seniors tend to delay. I've seen it again and again. You don't want to bother anyone. You think you'll rest and feel better. You tell yourself it's nothing. That hesitation kills people. If there's one thing you remember from this video, let it be this. Don't wait. Call emergency services immediately, even if you're not sure. If it's not a heart attack, no one will fault you for being safe. But if it is, and you wait, it may be too late. The earlier you call, the more treatment options are available. Medications can break clots. Procedures can restore blood flow. But only if we act fast. Time lost is heart lost. Call for help the smart way. When you're alone, you have to think quickly. Grab your phone. Use voice commands if you can't type. Say, "Hey Siri, call emergency services," or "Okay Google, call 911." Put the phone on speaker so you can talk without holding it. If you can't speak well, say your address slowly and clearly. Even just saying your location is enough. If you can't speak at all, use text if your service allows it. Some areas support emergency texting. You can also use medical alert devices that call help with one press. Keep your phone charged. Keep it near you at night. Don't leave it in another room. If you have medical conditions, keep a list near your phone. Medications, allergies, history. You might only have seconds where you can talk. Make them count. Stay conscious. How to keep blood flowing to your brain and heart. If you feel symptoms starting, act fast to keep yourself alert. Sit down immediately. Don't lie flat. Keep your back supported, legs bent slightly. This position helps blood return to your heart without making it work harder. Take slow, deep breaths. Focus on staying calm. Panic increases your heart's workload. Calm preserves energy. Avoid walking or moving too much. Stay still and centered. You may have heard of cough CPR. Let me be clear. It is not medically recommended for most people outside a hospital. For trained responders with equipment, maybe. But for seniors at home, don't waste time trying to cough deeply. Focus on breathing and calling for help. If you lose consciousness, your chances decrease. So conserve your strength. Stay awake. Stay breathing. Stay focused. Take aspirin, but only if you can safely swallow. If you're able to do it safely, take 1 adult aspirin, 325 milligrams, or 4 baby aspirins. Chew them. Don't swallow whole. Chewing helps the medicine enter your bloodstream faster. Aspirin slows blood clotting. That gives your heart more time. But it only works if you're not allergic, not bleeding, and not told by your doctor to avoid it. Don't take aspirin if you've been told you have stomach ulcers or bleeding problems. You're already on a blood thinner. You're allergic to aspirin. This isn't about taking it daily. This is a one-time emergency step. Always confirm with your doctor ahead of time if aspirin is safe for you to use. Keep a small bottle of chewable aspirin somewhere you can grab it quickly. Nightstand, bathroom drawer, pocket in your walker or purse. Seconds matter. Prepare before it happens. Your personal heart emergency plan. The time to prepare isn't when you feel pain. It's today. Right now. Create an ICE, in case of emergency, card. Write down your full name, allergies, current medications, medical conditions, emergency contacts, your doctor's number. Keep this card by your phone, in your wallet, and taped inside your front door. Store your phone in the same place every night. Close to bed, charged with emergency contacts saved. Install a medical alert app or wear a pendant if you're at higher risk. Talk to neighbors. Let one trusted person know your medical conditions and how to reach your home if something goes wrong. Practice. Seriously. Walk through what you'd do. How to sit. Where the aspirin is. What you'd say to 911. Muscle memory could save you, the mindset that makes the difference. People often ask me, what's the best thing I can do to survive a heart attack? My answer? Be ready. Mentally, emotionally, practically. You don't have to live in fear, but you should live prepared. If you're over 60, your risk is higher. That's not meant to scare you. It's meant to empower you. The most dangerous mindset is, that won't happen to me. Don't assume you'll always have someone with you. Don't assume you'll have time to figure it out. Assume only this. If you prepare today, you'll act faster, think clearer, and you'll give yourself the best chance to survive and recover. That's what I want for you. Not just survival, but recovery, peace, strength, confidence. You don't need to be a medical expert. You just need to know these 7 tips. Listen to your symptoms. Don't wait, call for help. Use your phone smartly, sit properly, and breathe. Take aspirin if safe. Prepare your space and plan. Own the mindset of readiness. That's what could keep you alive and thriving.